Hi everyone! So today I wanted to talk about fertility. Fertility is one of those medical topics that is not as widely discussed, and to a lot of women also it's very important. So first I want to start off with a basic introduction of the female reproductive tract. So most girls are born with two ovaries, and the ovaries are where the eggs or oocytes of a woman are contained. The ovaries are connected via fallopian tubes, which are thin, hollow structures, to the uterus. And the uterus is the organ in which a baby will grow during pregnancy. Now that we've discussed the anatomy, let's move on to discussing eggs. And there are two important things to talk about when discussing eggs, which are quality and numbers. So first, let's discuss numbers of eggs. Before a baby girl is even born into the world, while she's still inside of her own mother, she will have the highest number of eggs that she will ever have. At the time a girl is born, she has 1 to 2 million eggs in her ovaries. Over time, ovaries lose their oocytes in a process called follicular atresia. So by the time a girl hits puberty, she has around 300,000 eggs left. In the menstrual cycle, each month about 50 to 20 follicles, which a follicle is a fluid-filled sac inside which an oocyte is contained. 15 to 20 of those will grow each month due to hormones recruiting these follicles. And each month, only one of them will grow enough to be ovulated. During ovulation, an oocyte is released from the ovary, and it may be caught in the fallopian tube, and if it encounters sperm, it can get fertilized. If not, it will just be shed with the lining of the uterus with the menstrual cycle. The rest of the follicles that don't get ovulated will disintegrate, and they're about every month, 1,000 follicles are lost. After around the age of 35, the rate of follicular loss increases, and around menopause, that's when there are about no longer many eggs to be recruited. So that's why your period stops. So as we age, we lose oocytes, and this is just a natural and normal process and occurs even before we are born. The next thing to talk about when discussing oocytes in relation to fertility is egg quality. So you may have heard that the quality of eggs also decreases with age. The quality of eggs refers to whether the genetics of an egg are normal. So a normal egg should have 23 chromosomes, but as women age, the oocytes are more likely to get damaged and be vulnerable to damage over time. So an abnormal egg will have a number of chromosomes other than the normal 23. When a woman is in her 20s, on average, the majority of her eggs are considered normal, as opposed to a woman in her 40s, the majority of her eggs are abnormal. For oocyte with an abnormal amount of chromosomes, it's likely that it will not result in a viable pregnancy. So just like numbers of oocytes decrease with time, the quality of oocytes decrease with time as well. Although it's kind of scary to hear that as women age, the eggs are more likely to be abnormal, just because they're more likely doesn't mean they're going to be abnormal. So to summarize, for women, the chances of conception decrease with increasing age. And according to ASRM, the American Society for Reproductive Medicine, the chances of conception decrease for a woman significantly after the age of 35, which is when the rate of follicular loss is increasing. In America, 10 to 15% of couples are infertile, which is a large number of people. According to the ASRM, infertility is defined as trying to conceive for 6 months for patients over the age of 35 and being unsuccessful in getting pregnant. And for patients under the age of 35, it's defined as trying to conceive for 12 months without success. Some women desire to have biological children, but are not at a stage in their life where they are ready to be pregnant in the moment, but are also at an age where they're where they know that aging is affecting their fertility. And these women, in some circumstances, will choose to freeze their eggs to preserve the quality and quantity of eggs at their given age to be used for in the future. And an interesting statistic is only 6 to 12% of women who freeze their eggs end up using those frozen eggs. Having a child is a huge decision financially, emotionally, physically, and I think it's important for women to have a basic understanding of their fertility. So that's why I made this video, and I hope it was helpful for some viewers out there.